Hi, my name is Tamara Malasov and this is my head-to-toe physical assessment video. This is Sam, my husband, who agreed to be patient for this video. Before we begin, the patient emptied his bladder and the nurse outside put him in a gown, recorded his vital signs, his height and weight. This Snellen chart was used to measure his visual acuity. I washed my hands and now we are ready to begin with the exam. I'm starting with the inspection of his head. I'm looking at the shape, size, and symmetry of his head. I'm looking at the hair distribution, and I'm looking at the symmetry of his facial features. I'm looking at the symmetry of his ears. Now I'm going to start with palpitation. I'm using my pads of my fingers. I'm moving from frontal bone to occipital bone, and I'm also feeling for his hair, which is normal, smooth. And I'm also looking for alopecia. There is no present alopecia, and I can kind of just see a little bit of the balding in a male balding in the head crown area, and which is normal. Now his scalp is moving freely over the skull, and I'm now moving to temporal pulses, and now I'm moving to TMJs. Open your mouth, please. Okay, and he opened his mouth. I'm not feeling any popping, locking, or cracking sounds or feeling. Now we can move also to cranial nerves exam. So I'm going to ask my patient to clench his teeth. Okay. Squeeze your eyes. Wrinkle your forehead. Smile. Take your tongue out. Move from one side to another, and puff your cheeks. I'm going to ask you to close your eyes and tell me if you feel this.
Yes.
Okay. Now we are moving to eye exam, and again I'm starting with inspection. I'm looking at his symmetry of his eyes, eyelids, eyebrows. I'm looking if there's any discharges from his eyes. I'm looking at his sclera of the eyes, so there is no jaundice. And now I'm also checking for his I'm checking for conjunctiva, which is pink, and then I'm also looking at the shape and size of his pupils. So now I'm going to palpitate lacrimal apparatus around the orbital rim, which is normal. There is no edema, and now we are moving to pupillary light reflex. So I'm going to check his left eye, bringing the light from the side, and his pupil reacts. This is his reaction to direct light. And now I'm going to do the same thing, but looking at his right eye, seeing the pupillary reflex on conceptual light. I'm going to repeat the same thing from this side. Okay. The next exam is going to be cover and uncover test. I'm going to ask my patient to look straight at the tip of my nose, and I'm going to cover his eye. So now I'm looking at if there is any lateral movement from his uncovered eyes, and this is normal. Actually, there is none, which is normal, and I'm going to repeat the same. Look at the straight of my nose. I'm covering, looking uncovered eye, and there is no lateral movement, which is normal. And now we are going to also check for extraocular movement of his eyes. So would you just follow my finger? Okay. And everything looks good. So the next one we are moving to his ears, and again I'm inspecting his ears. I'm looking at the alignment of his ears. So if we draw imaginary line from inner eye canthus to occiput, and this is a normal position. I'm also looking if there is any discharges and inflammation from his external auricle, or actually canal, and there is none. So I'm going to start with the palpitations. So I'm going to do a tag test. I'm going to pull his pinna. So see, there is no sign, there is no pain and inflammation, which is good. And now I'm going to start inspecting, looking at his inner canal. So for adults, I'm pulling pinna up and back to check the tympanic membrane, and it's pearl and gray, and this is a normal sign. looks good. Okay. And now we're going to do a whisper test. So I will go behind my patient and whisper something in his ear.
Apple. Baseball.
The next test is going to be Weber test. So I'm going to use the fork and I'm going to ask my patient if he's hearing the sound better from left, right, or both ears.
Both.
The next test is going to be a Ryan test. This is air conduction versus bone conduction. So I'm going to ask my patient to tell me when he's not hearing anymore the sound. Do you hear it now? Thank you. Next, we are moving to nose. So with the nose again, I'm inspecting. I'm looking at at the patient's nose to see the symmetry on his face, to see if there is any visible deviation. Now I'm going to use the otoscope to see his mucosa, turbulent, and possible polyps. There is none. Looks good. And his septum is in the midline, and everything looks good. I'm going to ask my patient, we're going to do a sniff test. So I'm going to ask him to occlude one of his nostrils. Good. Another one. Okay, looks good. Now we're moving to the mouth. So with the mouth, I'm going to ask him again. I'm looking, inspecting. I'm looking at patient's lips to see the color of the lips. We are normal pink and possible crackles. There is no crackles in his on his edge of his mouth, and that could show possible deficiency of vitamin B12, iron, or anemia. So everything looks good. So I'm going to ask my patient to open his mouth. When he opens his mouth, I'm looking at his gums. I'm looking at the soft and hard palate. I'm looking at the floor of his tongue. And now I'm going to ask my patient to again open his mouth and say "ah" to me. Now that his throat is open, I can see his uvula, I can see pillars, I can see posterior to pharynx, and tonsils are not visible. And now I'm going to also ask my patient to open his mouth and take the tongue out. Okay. Now the tongue is in the midline, the color is nice pink. There is no crackles, so everything looks good. Now I'm going to check the gag reflex of my patient. So, okay, the gag is present, so which is normal. Okay. Now I'm going to complete the lymph nodes exam. So lymph nodes are usually not palpable, so I'm going to start with the preauricle, postauricle, occipital, tonsillar, mandibular, submental, posterior cervical, anterior cervical. Deep cervical are not present. They're very hard to palpate. Supraclavicular, infraclavicular, and then axillaries. Okay. Thank you. Now I'm moving to the neck. So again, I'm starting with inspection to see the symmetry. His neck is still upright. I'm going to ask my patient to take it. Okay, and do you want to swallow, please, for me? Okay, I can see that his thyroid gland is moving when he swallows. Okay, thank you very much. Now I'm going to start with palpitation. So I'm going to check carotid arteries. Okay, one at a time, not two. Okay, they're possible. Okay, and now I'm going to check for enlargement of his, to see if there's any enlargement of his thyroid, to see the size of his thyroid, which is better to do from the back. Looks good. Now we are going to auscultate. So with auscultation, I'm going to use the bell of the stethoscope to auscultate for bruits on his carotid arteries. So I'm going to ask my patient to take a deep breath for me. No, hold it, just hold it. Thanks. Okay, and now I'm changing to diaphragm, so now just did it. And now I'm going to auscultate for thyroid glands. Good. Now I'm going to check the range of the motion of patient's neck. So I'm going to ask him to just flex, extend laterally, and then we just shrug your shoulders, okay? So we are going to do the same thing, but just with the resistance. So good, back, okay? Now we are moving to the shoulders for his upper extremities. I'm going to palpate his shoulders, his arms, okay? Could you scratch your back? Okay, so range of motion is normal. And now I'm going to check also his radial pulses, oh, they're present, and for brachial pulses, okay? And now, would you just show me your hands? I'm also looking at his hands. I'm looking if there is any pallor on his palms, that can show the anemia. And I'm going to check the capillary reflexes. They're less than 3, brisk, and this is a normal finding. His skin is warm and nice. Now I'm going to ask my patient to turn around, so we are going to check his posterior thorax. With the posterior thorax, again, I'm inspecting. I'm looking at the thorax configuration. There is obviously no deviations. I'm looking at patient respirations, rate, rhythm, depth, and effort when he breathes. So obviously he is very calm. There is no, there's just normal. They're good. So now I'm going to start with the palpitation. So I'm palpitating my patient's back to see if there is any tenderness or pain. There is none, obviously. And now I'm going to start with I'm going to check with tactile fremitus. So every time when I touch you, would you please say 99?
99, 99, 99, 99.
Good, looks good. Okay, and I'm going to check the expansion of his lungs. So I'm going to ask my patient to take a deep breath. Okay. When he takes the deep breath, I can see my thumbs are moving symmetrically. So his lung expansion is very good. Now I'm going to start with the percussion. So I'm going to ask you just to put your arms, okay? So you're moving a little bit your scapula sides so I can percuss nicely. I'm percussing also laterally. Okay, and now I'm going to also I'm going to check his diaphragmatic excursion. So I'm going to ask my patient to take a deep breath, please. Take a deep breath. Okay. And I'm going to ask my patient to exhale his, okay. So his diaphragmatic excursion is 5 centimeters, which is normal finding. Now I'm going to start with the auscultation. So I'm going to ask my patient to take a deep breath every time I touch him with the stethoscope, okay? Thank you. Okay. Thank you. Now I'm going to ask my patient to turn around and we are going to check his anterior thorax. With anterior thorax, again, we are starting with the inspection. I'm looking at his respirations, rate, rhythm, depth, and effort. There is none. Everything looks good. So I'm going to start palpitating. Okay. Looks good. Now I'm going to also percuss his lung fields. Okay. Now I'm going to start with the auscultation. So every time I touch you, just take a deep breath, okay? Good. Okay. Good. One more time. Thank you. Now we're going to move to a cardiovascular examination, so I'm going to ask my patient to just lay down. Okay. With the cardiac, first we are doing inspection. First I'm going to look for JVPs. I'm going to ask my patient to turn his head over there. And obviously there is no JV pulsation. This is normal finding, which is normal. And again, you can just look straight. Again, I'm expecting to see if there is any pulsation, any trills, and there is none. So I can start. There is no marks. There is no any marks saying that was a cardiac surgery in the past. Everything looks good. So now I'm going to palpitate his apical pulse. And I'm checking for trills of pulsation in his precordium. Now I'm going to check his pulses. Okay. Mitral area, tricuspal, pulmonic, aortic. Okay, now we're ready to move to abdominal exam. And with abdominal exam again, I'm starting with inspection. I'm looking at patient abdomen to see if there is any rashes or lesions. There is none. I'm looking at the contour of his abdomen. I'm looking for peristalsis. I'm looking for any pulsations, and there is none. So now we are going to start with auscultation. I'm starting with the right lower quad. Okay. And now I'm changing my stethoscope to the bell. So I'm going to listen for, to eliminate bruise in a aorta, renal arteries, iliac arteries, and femoral arteries. Okay. Now I'm going to move to percussion. So with the percussion, I'm percussing all over the abdominal fields, all four quadrants. I'm listening to dullness, and tympany, which are two prominent sounds of abdomen. Now I'm going to percuss the liver, just to see to determine the size of the liver. Okay. And his liver is 10 centimeters, which is normal finding. Now I'm going to percuss over the splenic area. Just turn around, just a little bit towards me, thank you. Okay. Usually spleen is not enlarged, and he's not, so this is the normal finding. Okay. Next one, I'm going to move to light palpitation. So I'm going to look at the patient's face while I'm doing this, and he's going to tell me if he's feeling any pain.
No.
Okay. Okay. I'm going to do now deep palpitation. So again, tell me if there is any pain. Okay.
No.
Now I'm going to palpitate his liver. Okay, I can feel his liver edges here. And now I'm going to do palpitation of his spleen. Okay. And now I'm going to do palpitation over his kidneys. So I'm going to ask you to take a deep breath, please. Okay. I'm not capable to do it because of abdominal tissues. So again, okay. Thank you. Now I'm going to check for abdominal muscles. So I'm going to ask my patient just to, okay, his abdominal muscles are strong. You can go back. And now I'm going to check for aortic pulsation. Okay, I can feel it. And I'm checking the position of his aorta, and it's in the midline. And okay, thank you. Now we're going to move to musculoskeletal, and first I'm again inspecting, looking at. I'm looking at his legs. I'm looking at muscle strength. I'm looking at hair distribution, the color, and I'm going to palpitate. So his legs are warm, hair distribution is normal, and I'm going to check for muscle strength. So I'm going to ask my patient to push, okay, good. Okay, his strength is good. I'm checking also capillary reflexes, just relax. I'm checking capillary reflexes, and they're less than 3 seconds, which is normal. I'm going to also check his dorsalis pedis pulse, posterior tibial, and popliteal pulses. Thank you. I'm going to check also for sensation. Tell me if you can hear, can you feel sharp or dull?
Sharp. Dull. Sharp. Sharp. Dull.
Okay.
Sharp.
He's not diabetic, so usually we are going to check also with filament test. So do you feel this?
Yes. Yes.
Okay, thanks. Now I'm going to, would you please sit, please? I'm going to check for reflexes. So I'm going to, I'm not sure if I checked for radial pulses. Let me check again. Okay? Checking the radial pulses. They're here. I want to just be sure that we did it. So I'm going to also check for his brachial reflexes. Okay? They're present. I'm going to check for his patellis knee reflexes. Okay? And I'm checking his Achilles tendon reflexes. Okay, they're present. Now the last test is going to be, I'm going to ask my patient to stand, and then I'm going to check his cervical spine. So I'm going to ask you just to stand here and just bend your, okay? And while I'm checking here, you're going to also tell me, do you feel any tenderness, tingling, numbing in your arms? No? And I'm going to ask you just to bend a little bit more. Okay? And his lumbar looks good. Okay. So that was my head to toe physical assessment video, and thank you for watching.